So, Don, welcome to this podcast. Very excited to be meeting with you. I want you to tell the listeners about you and your journey, but could we just start with that question, why you think integrative medicine matters?
Yeah, I think it's becoming increasingly evident that we have a great need for integrative healthcare, not just nationally, but globally. I think that as time has gone by, we've seen this kind of system that's been in play that hasn't really served as effectively as it might. And so what I've seen is a lot of practitioners and particularly doctors at all the events that I've been going to literally over the last decade, actually. And I've seen this shift towards people actually coming out of a system which they felt burned out by, and that they weren't being as effective as they wanted to be. And I heard the conversations from the platform of a number of speakers, a number of doctors at the Institute for Functional Medicine, and also the Integrative Personalized Medicine conferences, and all of the podcasts that I tune into. And have done for a good number of years. And I think the momentum has shifted and changed because there's a need and there's a desire, and it's being driven by individuals. It's being driven by this, I think, a almost a tsunami really of things not working as effectively as they might. So I've seen it in practice in terms of people coming into the integrative space or into the holistic space because they have not got the results or outcomes or health outcomes they've been looking for. Maybe something as simple as gut issues or skin issues or things that, they've been applying topical creams for or prescriptive medication for years and years, and it really hasn't treated or hasn't resolved what they have been had symptoms for, and getting to the root cause of their symptoms. And so I think that there's an awakening coming through now of practitioners finding that they can be more effective if they embrace a more holistic approach, which is looking towards traditional and holistic practices, whether it be Ayurvedic, whether it be TCM, traditional Chinese medicine, which has been around for thousands of years and served very well other communities and systems. And so I think yes, it really does matter because if we're here to get the best health outcomes for communities, for individuals, then it just makes sense to think that you have to consider the whole being, and the systems are all integrated. And I heard a beautiful account of this by Dr. Mark Hyman. He said, listen, everything is about systems biology. Things don't work in isolation in the body. So if you try to think, oh, okay, is the heart separate from the brain? Is it separate from the gut? Is it separate from all these different systems that we have? The body doesn't work like that. And so if you're sending someone off to go and look at one part of the body that may be useful for something that's very, very specific, but everything is connected. And then when you understand that, if you don't look at the whole being, then you're going to be missing a large part of the interplay that goes on. And so I think that's why integrative medicine matters so much, because everything is so intimately connected
Yeah.
physiologically and anatomically.
Yeah, I so agree. And I think, a lot of the healthcare professionals that join up for our masters in integrative healthcare, they're feeling very squeezed by this system that has kind of broken into bits rather than seeing people as whole beings in complex systems. And in fact, the first thing we do when we're beginning the masters is to look at complex systems so that you're thinking from the beginning about how the body works as a whole. But before you get that expert information about organs or cells, it's often the interrelationship that can be the issue, whether that is the relationship with your mitochondria, but it might be the relationship with your mother-in-law, or it might be the relationship with your values and visions. So there are so many reasons why we can feel very squeezed in the system. And that broader model, that diverse model, really kind of brings a bit of ventilation into the whole experience for a lot of healthcare professionals. So, Don, I want to dive into your journey to this point. Like, tell us about your life as a integrative clinician.
Well, it was really brought into view and focus for me when I became injured myself. And I think that's the case for a lot of people. When you had that hard kind of reality of, oh, I'm not very well, or I'm not getting well, or I had this particular condition, what am I going to do about it? I'm going to go to the people that can provide solutions for me. And so when I had a chronic back condition and I was coaching and training people at the time, and I was in my late 30s at the time. So I'd always been physically active, very, very active, doing performance sport, competing, being parts of squads and helping other people get into peak performance. But then when something came home to rest for me, I think maybe it was overdoing things from an immune system perspective, and perhaps stressors coming in that I wasn't conscious or aware of or paying attention to. And suddenly I found myself with a bulging disc in the back. And I went to 4 practitioners to try and resolve what it was. I thought, oh, I just hurt my back. Well, it was a little bit deeper than that. And then when I found myself teaching a class and I had a reaction that went from the base of the spine all the way up to the brain, and I thought, I'm in trouble. And so I went to actually to a naturopath and osteopath in Harley Street. He was recommended to me after I'd been to chiropractor, a Australian sports physio, had acupuncture, and taken a lot of painkillers to mask the pain. And this naturopath and osteopath in Harley Street said to me, "Your back's so badly inflamed, you've got a lot of inflammation here. I can do a little bit of adjustment work for you, but I want you to take," and here was the light bulb moment for me really diving into the integrative space, was, "I'm going to give you an intensive course of enzymes." I thought,
Mm,
how's that going to help? Exactly.
mm,
Because I didn't understand the chemical interplay with inflammation and how proteolytic enzymes, which they were, and I had to take 10 of them every day for I think a 7-day course. So proteolytic enzymes, which help dial down inflammation. I wasn't aware of the power of this natural intervention. So not painkillers, enzymes. So I thought that really caught my attention. I was very strong on anatomy and physiology and biochemistry, and so that sort of really appealed to my curiosity, because I'm a very, very curious individual. I like to know how things work. And so I thought, ooh, this is really interesting. So that was a catalyst for me to actually think, oh, I don't actually know very much. And I've done lots of qualifications in nutrition, in anatomy and physiology, and training and coaching. So then I went on to do a nutritional science degree. So 3 years at the Center for Nutrition and Lifestyle Management, nutritional therapy diploma course. And then I began to learn more and more about these biological systems, evolutionary biology, biochemistry, and the interplay, enzymes, yes, and a lot more besides, and mechanisms of action. And so this really appealed to me. It appealed to my academic rigor, although I found it quite tough, particularly biochemistry, as opposed to organic chemistry. And that was really the start for me to become more attuned to this interplay and the intimacy of natural interventions that could bring about a different outcome. So after that point, I went to work at a chiropractic clinic as a nutritional therapist and physical therapist, and began to learn from the clients and the patients that came into me who had back issues, who had influence issues and inflammation, who had trauma, who were struggling with various symptoms around skin conditions and the like. So that's where I learned my craft really over 5 years, working in a chiropractic clinic, working in a clinic where I was delivering health talks, introducing people to holistic picture of care, and using proteolytic enzymes in practice for reducing inflammation. And I found that it worked. really effectively.
Do you, we've talked about inflammation and how in the past kind of 5 years it's really now come into mainstream thinking. So you might have an injury, but if you've got background inflammation that hasn't been addressed, it might promote that problem into a chronic problem. But can you tell the listeners and me how proteolytic enzymes do work to reduce inflammation?
Well, there are different forms of them, and one of them is actually, it comes from the silkworm. It's called enzyme or serapeptase. And I've discovered this many years ago now, and it works on the basis of breaking down scar tissue. With trauma or with inflammation, what happens is we have the inflammation to protect us. If we get a bruise or an injury of some description, we have an immediate acute response where we can get swelling and heat builds up, and this is protective initially. If it becomes more persistent, then it can become chronic. And one of the biggest drivers of inflammation is what? Stress. So understanding those mechanisms of action, but we're not designed to have inflammation over a longer period of time, short space of time to protect ourselves. And then we get pro-resolving nutrients that can reduce the inflammation, which are the vitamins such as antioxidants like vitamins A, C, and E. But the enzymes, which are protease, amylase, they come from things like papaya, for example. So they can come in naturally occurring fruits, but the protein, one particular one comes from the silkworm, and it actually scavenges scar tissue. So the whole process of the silkworm devours scar tissue as food and breaks down the inflammation that builds up in and around the joints or the target that's been affected area of the body, the target area of the body. So it's these enzymes that occur naturally in fruits and in plants as well. We've got papain, we've got bromelain, for example, which comes from pineapple. So we have these naturally occurring elements in the fruits and in the naturally occurring substances all around us. And indigenous groups and ancient apothecaries have known this for centuries, right? They have this inbuilt and is handed down through cultures. And so if you live in particular regions, then there will be people who understand and have known this for centuries. We're now just gathering up a pace, I think, in the integrative world. But I think that's generally how we gather these enzymes. They come from naturally occurring substances. But the silkworm is an interesting one with the serapeptase, which is a proteolytic enzyme. So it breaks down that inflammation.
Yeah. And so often I'm reminded of the way that nature provides for us in so many ways. If we can, have a degree of respect about what we take and how we take. But, the ancient tribes knew that, and we were teaching at the Botanic Gardens in Bristol and looking at some of the knowledge of the Native American Indians around things like black gohash, and it's all there and available. So I want to take the next step because you and I have connected with fasting and how that reduces inflammation. And I was really struck by one physician in the States just describing his work in chronic pain, that when he was able to create a facility for people to come in and do a short, prolonged fast, one of the things that happened is their pain experience dropped. But can you tell us, first of all, what is fasting? What's a good definition of fasting?
I think there are different definitions actually, and the most well understood one definition is the absence of food and water for any period of time. That's a kind of common definition. And then you've got another definition, which is the physiological definition, which is when ketones get in play, we're not having presence of carbohydrate or sugars coming in. As a physiological transition or metabolic switch comes in from the body. And that can happen after a couple of days if you're having a water-based fast for a couple of days or longer. The body then goes into a different system, which is embedded in the body, and it develops ketones, which is beta hydroxybutyrate, as we know. So these ketones get generated, and then we use ketones for fuel because the body won't shut down, the brain won't shut down. It goes to a different substrate as a use for fuel. So it will use fat for fuel, for example. Now, there's another definition as well, which is, I think, the molecular definition, which has been founded really and discovered through the work of the likes of Professor Longo. And it's a fasting mimicking approach where we can have just the right amount or a small amount of food coming in. It's restricted in terms of the amount of carbohydrate that comes in, but it's a prolonged fast. So it's a fast that goes on for up to 5 days, but it's quite restrictive in its intake in terms of macronutrients. But what happens is that after a certain period of time, we have the mechanism of autophagy that comes in, and that process is where we get cellular regeneration and cellular renewal. And with that comes the benefit of dialing down inflammation, because inflammatory markers get down regulated, which is C-reactive protein. Those markers are demonstrated in research to be dialed down when you embark upon a prolonged fast, which might be more than 2 days, and a fasting mimicking approach. So there's that molecular definition, I think, that's becoming more popularized and more recognized in research. And so we see that we've got intermittent fasting where you can do it for, a couple of days, maybe a 5-2, which Dr. Michael Mosley brought in with the Fast 800. So with these restricted practices, we can have a time-restricted eating window, which is a 16 to 8 window. So we're only eating within a restricted space of time, an 8-hour window. We can have a 12 to 12 regime. We can have a 16 to 8 regime. So there are different types of fasting that will get different outcomes, and depending on the time, um, and also the nature of the nutrients that are coming in or not, we can get a different outcome. So I think there are different touch points in terms of fasting, and they can mean different things to different people. But definition of terms, I think there are some common definitions that people are becoming more familiar with, whether it be intermittent, prolonged, or time-restricted eating windows.
Yeah, that's a really great summary. And again, just for our listeners, metabolic flexibility, the ability to either burn glucose or burn ketones, that will only come into action if we stop eating for a while. And so one of the, I guess, the big messages about the rise in inflammation is just that we're eating too much too often. And also, if we're eating ultra processed foods that the body experiences as foreign, essentially, because they're so unnatural, that can also trigger inflammation. So sometimes I try and keep it really simple and just encourage someone to stop eating at 7 and not eat again until 7 a.m. So 7 p.m. So that would be 12 hours just of giving the body a rest, allowing this amazing clearing, cleansing system to activate. And I love the fact that you've mentioned ancient wisdom, because, like Ayurveda, many spiritual practices would always encourage a period of reducing food. Like, we're not recommending, please don't stop drinking. Drinking is really important in terms of water and fluid, but just sometimes giving the body a rest from eating. Can you say a little bit, though, about some of the research that's come out of that prolonged fast? Because you mentioned autophagy and this issue of longevity. I know this is something that you've been really interested in. I just wondered if you might tell us a bit about the science of what happens when we can, around 72 hours of a prolonged fast, trigger autophagy.
I think that what people like Professor Longo have found is that autophagy can peak around about 72 hours. And with that becomes that cellular renewal and that cellular regeneration and stem cell production that happens, but only happens with a particular time frame. And also, I think that what we're finding is that it has quite a deep effect on the body because it has a coordinated response. So a lot of systems, we mentioned systems before, are connected. So the brain, the heart, the liver, and all of these organs are influenced because we're not getting the insulin response. So we have insulin sensitivity coming into play. With the brain is getting ketones for fuel. So we have this clarity coming through round about day 4 on a prolonged fast. And then when we see autophagy coming into play, then we have misfolded proteins, organelles that aren't working correctly that are not useful for us, the body says, I don't think we need that anymore. So we're pushing out and almost a cellular detox, if you will, of the cells that aren't working correctly. And when we don't have this too much information coming in, because that's what food is, it's information, right? So too much information, we have information overload. That happens on a ecosystem perspective for our bodies. If we have too much, guess what? Then it's too much, and the body will start to dysfunction. It may be from an obesogenic perspective, it may be from a cardiovascular perspective, or even from a cognitive perspective. So if we have this abstinence or this period where we can dial things down, then we can get new information which the body says, oh, hello, I like the look and feel of this. And I'm now going to get out my cells primed, and I'm going to have them optimized. And this is where the longevity comes into play, because we're actually extending our capacity for longevity because we are giving ourselves periods of rest. And I think in the fast-paced environment, particularly in the West, we're just so wired and we don't have that space. So this is where fasting really speaks into that. And a lot of the research is showing that if you can dial down these inflammatory markers, then when we have a coordinated response, we have a universal effect on the body at a cellular level. And so we can reset. And so this metabolic reset comes into play. And I mean, I have worked with hundreds of individuals over the past 4 years and seen up close and personal the effect that it's had from a transformational perspective on gut issues, on skin issues, on clarity, on performance, and also from a visceral fat loss perspective. And I've measured biomarkers and seen, and because I was skeptical initially, and I thought, oh, does this really, really work, this approach? Like a lot of people, we think, oh, no, I don't know. But I actually tried to mimic some of the research that had been done in my own practice. And I found that it did exactly what the research found. So that really enforced and reinforced the practice for me in terms of this prolonged fast to reinform or to get a better understanding of, does it really work? I found that it does. Research papers, and there are maybe 30, 40 plus papers now in the area of oncology, of IBD, irritable bowel disease, of type 2, borderline diabetes, dialing down HbA1c and other cardiometabolic markers, and getting really, really interesting health outcomes. And so they have programs now in the US where they're using this as a primary tool for helping people with type 2 diabetes. And also in the area of oncology, where we find that it acts as an adjunctive therapy alongside conventional therapy for a better health outcome. And I think that the number of books that have been written, and one that Professor Longo has written recently on fasting for cancer, he's had so much success in that specific area. There's a lot of interest coming in because it's been done in human studies. And this is really, really powerful and valuable, and now more longitudinal and more wider population groups. So I think it's very exciting to see that research coming through. And if you do a simple search, even on PubMed, you'll find those papers coming up. And I think there's a lot of interest in the area of integrative care for the use of fasting. And we're seeing that from a research and evidence-based practice.
Yeah, and we can give a few links in the show notes. As a cancer doctor, when fasting first came in and a few amazing pioneering patients were exploring it, it was a total antithesis of what felt sensible, to restrict food when you might be restricting food because of chemotherapy and maybe it would be weakening. So having these high quality studies is really important. Just for the general population, I think that theme of overwhelm that you've brought in is really helpful, because you and I have talked, haven't we, almost like the kind of the spiritual element as well of fasting, because it's interesting to see that the cell can actually get overwhelmed by the number of glucose molecules. And actually, if they're stuffed into the cell, they actually impact negatively on the mitochondria, which are our powerhouse, our battery in every cell. So then we suddenly realize that we're eating, but we're fatigued at the same time. And so, I was often given the message early on in life, well, you must eat or you'll feel tired. And it's been quite illuminating for me to time restrict my eating and find I had more energy. And I think, we're overwhelmed by information in a similar way, by technology, by complexity. So there's also something about just getting simple and stopping and allowing a kind of a quietness to emerge. Would you agree? I think that mind, body, spirit is also really important in integrative medicine. We get excited about the cell and insulin and metabolic flexibility, but there's just something about that simplicity as well.
I think you're absolutely right, and that is so vital to bring that into the space. And I find that when I'm working with individuals and even with groups, you mentioned the word antithesis, and I think when you say to people, then we're going to restrict our intake, and you'll see the eyes will go wide, and it'll be, "Will I get hungry?" is one of the questions that I get asked. Can I have any snacks? And you have this conversation. It's kind of, well, the objective here is for us to create space. So let's try and reframe that and think, because nothing bad is going to happen. So intention setting is really, really important. What's your intention? What are you really looking to gain from this practice? So I think mindset is really, really interesting. And I did successive cycles of a fasting mimicking approach over 3 months. And I found that each time it was different. My mindset shifted and changed in terms of my approach. I realized, oh, maybe I wasn't hydrating well enough. Really,
Mm.
really important component. And was I having enough of those minerals that are present in um, electrolytes in water, which we don't get when we are not eating? Because guess what? All those sodium, potassium, and magnesium is in food. So if we're not having the same level, then our electrolyte level, our mineral level, will go down. So paying attention to hydration is really, really important, particularly during the fasting phase. But you mentioned the spiritual component and mindset. I think that space enables you to peel back layers
Mm.
so that you can get down to the root cause internally, and that may be a metaphysical level and a spiritual level as well. Am I nourishing my mind, body, and spirit at the same time? Can I do that? Is it available to me? The answer is absolutely. Have you thought about it before? Maybe not. So I think that connection that we're trying to bring into this space is one of mindfulness, yes, and thinking about the outcome. Oh, I want to lose weight. Okay. Now, maybe it's emotional weight that we're talking about, and that attachment, which is a comfort that we go to when we're stressed. So we eat. Also, how are we addressing that component within the space is super important. Obviously, we find from ancient traditions that it's embedded culturally that you have this time of abstinence so that you can get clarity of mind, of body,
Mm.
and in spirit. You can connect at a higher level and in terms of resonance and frequency. And all of our cells have a frequency. And understanding that will get you a different understanding, perhaps, of the needs of nourishment at different levels for the body. So I think mindset, really, really interesting area to explore for people. And I think that, I went on the conference that the National Center for Integrative Medicine did on trauma-informed care. And that was super, super interested in the fact that the trauma and stress, how that impacts the body and how that can lead to one driver around obesity, for example. So I'm thinking addressing the mind as much as the body spirit is a super part of this holistic picture and this 360 approach. So I don't think we can take that component out of our space, whether it be fasting or even our healthcare.
Yeah. And what I love about integrative medicine is that 360. So you've got a lot of tools in your toolbox, and it might include knowledge of fasting. It might include knowledge of meditation, understanding trauma, so that when you're working with someone, you can see those barriers that we come up against when we come up against ourselves. I also love Pauline Cox's phrase, a low insulin lifestyle. And I just wanted again to say to our listeners around insulin being a super important hormone that kind of transports glucose around the body. The liver's really involved with where glucose is put. If there's too much glucose, it will have to organize to put it into fat. And I think that, again, just people's understanding and knowledge of, when we fast, we drop our insulin. If we have areas of inflammation, this C-reactive protein that you talked about, we'll drop that. And so these are real physiological changes. But just to acknowledge that it's not always easy. And the other thing I talk about is just lowering your carbohydrates. At the moment, with our medical undergraduates who have joined us for 6 weeks, we're doing something called Let's Go Keto, not because we're recommending, a ketogenic diet. We're learning about it. We're learning about what the physiological changes and where ketogenesis might occur and when it's used, like, for example, 100 years of it being used for intractable epilepsy because it slows the brain down in terms of excitability, and now it's being researched with bipolar disorder because, again, it might help brain health. And I guess what I like about integrative medicine is we might know about keto but not necessarily try and be there all the time, but we know what it's like to either fast, we know what it's like to keep our carbs low, we know what it's like then, we can feel how the body's dealing with carbohydrates. And I think what you've touched on then is not only insulin sensitivity, but body sensitivity. I did want to just ask you, I know we have to finish soon, just about ketones. Can you tell us what ketones are, how you can measure them? Sometimes when you're fasting, you might support someone to do that.
Yeah, I think there's a lot of technology coming into play now, and we see that there are, various devices that can monitor these things. And I think it's important to understand the nuances around using those sorts of devices, whether it be CGMs, continuous glucose monitors, or ketone monitors. And, I worked and helped set up a charity which helped families and individuals in a rare epilepsy syndrome, which is called Ring 20 syndrome. And I worked with a lot of clinicians and neurologists, and I did my dissertation on the implementation of the ketogenic diet for rare epilepsy syndromes. So I had a good bit of exposure to that and its use in clinical practice. So I think, again, definition of terms is really important. So what you're talking about ketogenic diet, well, which one are you talking about? You've got classical ketogenic, are you talking about modified Atkins, for example? So there are lots of different applications, and they must be used in a clinical setting, particularly when it's in and around particular conditions. And so if the body is starved of glucose, then it will produce fuel of its own, and it will produce that from fat. And that's how ketones get generated from fat reserves from the body, or it will convert fat into beta hydroxybutyrate, which is ketones effectively. And this only happens when when insulin is not spiked or present, because insulin is spiked in the presence of glucose to break it goes down to shuttle it into the cells. But when the glucose is there, then the body says, brain can't shut down, I need fuel. Where is it? It's going to go to fat for fuel. So that's how ketones can get generated. Now, there are ketone supplements that you can get out there, and people use that when they are on a keto type of approach. But I think that you can measure blood ketones are the most accurate measurement. Sometimes you can get urinary strips that can measure the presence of urine, but the timing and accuracy of that is kind of a little bit muddied and not as accurate as blood ketones. And you can get something called a keto mojo, I think, do a little blood ketone monitor. And a lot of people who are dealing with epilepsy or on a particular regime, they will have to monitor their ketones very carefully under supervision with clinicians, so that they want to be generating ketones to modulate this activity or this excitability that goes on in the brain. to help with management of seizures. Measuring the ketones is really important, and you can get a blood ketone monitor, and that can measure them. So you're looking for them to be in particular ranges. I'm not going to tell you what they are just now, but you're looking for it to be in a particular range so that you know that you're generating ketones. So if you're on a particular regime, you can get a Keto Mojo monitor. There are other devices as well. And then you can measure whether you are getting into ketosis. Now, actually, research shows us that women enter ketosis faster than men, and that's because it's estrogen predicated. And then, so cyclically, that's interesting. You can get into ketosis faster if you're draining your muscle glycogen, your liver glycogen, which is where energy gets stored. Once those stores are used up, then the body will start to generate ketones. And so if you do a lot of exercise and you find yourself getting all a bit lightheaded, then your body wants energy, right? So where's it going to get it from? It will start to generate ketones. So that's how we generate ketones. We generate them from fat stores or without the presence of insulin getting spiked. And what's interesting is that people who are perhaps borderline or pre-diabetic and want to stay away from things like snacking, because as soon as you bring snacks into between your meals, generally you're going to find that insulin will get spiked again. So Dr. Jason Fung talks about this in his book, The Obesity Code. And I found this quite interesting from an endocrinologist and talking about that. Cut out the snacks because you don't want to be getting insulin spiked in between your meals. You want to have that fasting in between your meals. And when you do it overnight, obviously it happens automatically. So that 12-hour period you talked about earlier on is an important period. Don't be eating too late because we should be resting, and then you get metabolic rest overnight, and then the body can recharge and it can do the repair work. And that's when we do a lot of repair work overnight. We get the lymphatic system gets stimulated, and that's when we do a lot of detoxification overnight. So don't be diving into that space and stimulating insulin too late on in the day. Otherwise, we'll find that could be problematic from a body composition perspective.
Yeah. And just a couple of things. The body is very clever at keeping that ketone level safe. We're not talking about in type 1 diabetes, if someone doesn't have enough insulin, their ketones can go up dangerously, and that can create something called diabetic ketoacidosis. So just be aware this is very, very different. You're looking at ketones around kind of 1.9, and we're not looking at anything above 3, which is dangerous. And so this is not something to stay in for any length of time, because what the body is designed to do is come in and out. What it wasn't designed to do, as Don was saying, is to snack continuously. And that sometimes can be the first thing to work with, is just to try and cut out those snacks in between meals. What you will find is if you can drop your carbohydrates and therefore drop the amount of insulin that your body's producing, you stop feeling hungry. I call it a low burn, a slow burn. And it's a nice feeling. You don't feel hungry. Just to say that one of the key things I learned when I started to do my 12-hour fast to begin with is at 9 p.m. every night, I would think, oh, I really need my peanut butter on my oatcake. Now, what I realized is that was ghrelin, our hunger hormone, that had been trained to release at 9 because it thought I was in a nice little loop of needing food. And so you do have to ignore hunger initially. You have to just say, that's my ghrelin, that's going to settle down. And so now I can go from 6:30 to 8:30, and I wasn't very metabolically flexible before, without a problem, because I'm not triggering insulin and I'm ignoring ghrelin until it quietens down. We probably have to finish, Don. You've got another meeting. We could talk a lot more, couldn't we? And Don and I have created a 10-hour discovery course. We'll give you the links in the show note about fasting for longevity. It's a fascinating area. either for you personally or for you to support clients and patients. I would say that anything we're talking about here, I wouldn't try and just head out on your own. I'd get support, apart from those simple things of trying not to eat in between meals and trying to have a 12-hour fast. That could be very safe for you to just explore. But otherwise, I would get someone expert like Don to support you, or the team at the National Centre for Integrative Medicine. I wanted to say a big thank you, Don. I've learned a lot about your journey, more than I knew before, and all this incredible expertise that you have now, and that what I love about you, Don, is that you communicate so clearly and reassuringly. You've helped me do some prolonged fasts, and it's that human touch that I think makes such a difference. So thank you, Don.
Thank you so much. It's been a pleasure and an honor to be part of the podcast.